Healthcare is an issue in which every American, every family, and every business has a stake. Over the past weeks, I've had a series of meetings with doctors and nurses, hospitals, healthcare plans, healthcare advocates, businesses, labor unions. We have one of the lowest rates of uninsured in the country. We are a low-cost, high-quality state when you compare us to the rest of the nation. Now, we can make improvements to healthcare disparities here in Minnesota, and we can do a lot more to achieve universal healthcare coverage. But we also have a serious problem that I want to fix as we move forward with healthcare reform, and that is our state's rate of reimbursement by Medicare. As a low-cost, high-quality state, our providers and hospitals receive among the lowest rates of Medicare reimbursement in the country. In other words, they're penalized for our state's success. This needs to be fixed in legislation. And in your packet of materials, and as a former teacher, I dare to tell you to look at your materials, because that means you're welcome listening to me, but if you look at your packet of materials, I have a letter in there. I sent a bipartisan letter along with 27 House colleagues to House leadership urging action of fixing Medicare's geographic disparities. There are 17 states in the same boat that we are, where the doctors and hospitals are underpaid. Medicare geographic reimbursement disparities needs to be fixed. If we are going to remain competitive in Minnesota for attracting the very best of healthcare providers. Right now, it is not economically viable, quite often, for people to choose to practice medicine in Minnesota because of the low care cost of the way that they're reimbursing their Medicare payment. That means that we can end up with fewer providers, and that hurts all of us. It hurts every one of us, not just Medicare patients. Fixing Medicare's reimbursement to Minnesota providers is a priority, along with fixing Medicare Part D, the donut hole. It is forcing seniors and the disabled to spend thousands of dollars in out-of-pocket expense for drugs. We can do better for the most vulnerable in our community, our disabled, and we certainly deserve to treat our seniors with more dignity and respect. My commitment to you is to work to pass the best legislation we can that addresses three healthcare factors: cost, access, and quality. Now, I'm looking at this process with an open mind. I'm going to be realistic. The final outcome will not be a perfect solution, because each one of us has our own idea of what a perfect solution is. But I'm committed to work to make progress. Let's start with the premise that if you like your doctor and your other healthcare providers, you should be able to keep them. If your private healthcare insurance meets the needs of you and your family, that's great. It's yours to keep. Secondly, I want to eliminate the national healthcare rationing that's going on right now. Healthcare rationing is right now, and it's driving up costs. Because right now, preventative care is rationed, and that results in emergency room visits, hospitalizations, for things that are preventable and treatable when caught early. Thirdly, I want you to know that I clearly support a public healthcare option. Healthcare in America. Not a privilege for those who either have access to insurance or can afford insurance. A public option is not socialized medicine. For those who are, everybody's going to have a chance to speak. A public option is not socialized medicine, as those who are fighting to maintain the status quo like to refer to. Let's start with what we have in the United States right now. Medicare is a government-run healthcare. The Veterans Administration is government-run healthcare. The Department of Defense provides government-run healthcare to millions of our soldiers, sailors, airmen, and Marines. If you are uninsured or underinsured or a dislocated worker, or if you have a pre-existing condition, or you're at risk of losing your job, and you have an adult dependent who is not covered by your insurance any longer, public option healthcare insurance will be our best opportunity to expand access and improve the quality of care for millions of Americans. will be people's health, not profits. Now I have a handout that is about America's solution and affordable health care in the package. And inside what that does is it puts forward the basics, a draft that's in the U.S. House of Representatives, sponsored by the Democrats, and the House Ways and Means Committee, the Energy and Commerce Committee, and the Education and Labor Committee. This is a draft summary. It is a starting point for the discussion we will have here tonight. There is a lot of work to be done before we have a final product. And as I said, I've come here to listen to you, your ideas, your thoughts, and your concerns. This is an open forum, so I would encourage everyone to speak. We have microphones here, and we have a handheld if someone has a mobility challenge. I would ask to be respectful because there are many people here, and to try to keep your comments to 2 minutes. And Andrew will be our timekeeper, and he will signal when 2 minutes has come and gone. It's not my intent to respond to every speaker, because if I do, I will not be able to hear to as many of you as possible. But my staff is here, and we will be taking down notes, and there's comment sheets here, and so if I didn't respond and you asked a question, or if you didn't have a chance to ask a question, please fill out the comment sheet. We will respond to you, but in order for you to be successful in doing that, please try to make it as legible as possible. I would ask the speakers to introduce themselves, and once again, if there's someone who does not want to be on tape, Josh and Melissa will work with you to make sure that your question may be asked out loud by myself so that you're not on camera. I'm going to touch on briefly a few of things that came up, but one of the things I want to touch on really quickly right away, and only one person brought it up, but we've gotten a lot of mail on it, a lot of questions on it. People have stopped me in the grocery store and that around. It's dealing with the medical electronic records and medical privacy. I am a supporter of people's right to privacy. And what we are doing in the medical electronic records has to guarantee that privacy, and those safeguards have to be put in, and it was something that the Bush administration wasn't focused on, and many of us in Congress now with the new president are saying we need to be focused on it. But electronic medical records, I want you to just kind of think back in your mind. I go to, I'm a woman, so I do some annual exams once a year. That's why they're annual. And I am really tired of filling out the same form at the same doctor's office all the time, knowing that that's adding to your bureaucracy. I would like, the one time I had to go see, and I'm using myself as an example, the one time I had to go to another specialist, I got the same paperwork in a different format to fill out all over again, and I said, didn't my doctor send you my records? That is one way in which we can cut cost, and we can gain efficiency, and yes, even provide better care, but we need to do it in a way that protects individual privacy, and we work with the care providers to come up with a form that is useful, efficient, and effective for them. So I think that the point about the privacy that the gentleman raised is one which I want him to know I take very seriously. People have been talking about how do we afford to do anything, whether it's single payer or public option, how do we pay for that? We know that there are a lot of waste and abuse in the current system that we have. We know we can eliminate those efficiencies. I hear from the care providers, I even hear from the hospitals. All the different forms that are out there is absolutely crazy, it's ludicrous, it's not friendly, and money is being spent by providers to have someone go through the paperwork who aren't directing care to you. We can increase efficiency. We can reduce administrative costs. We can also work more efficiently to eliminate fraud and abuse. We even saw some of that here at the state level with some of the federal plans that were being administered, with having more watchdogs, more oversight. We can also by focusing on prevention, reduce cost. If we manage, as people were pointing out with diabetes, early on with, first off, preventing it from happening, but for those individuals who are diagnosed with diet, support, the right kind of interventions early on, we can manage that chronic disease to have a much better quality of life for the individual who has the disease, as well as savings for all of us. So there are many ways in which we can work to reduce costs. Is that going to solve everything? No. Another issue that has come up at the insurance companies, and I know some of you have seen this reported in the news, is the insurance companies say, well, if we go to a plan where everybody has to purchase insurance, and for those, there's no cherry picking allowed at all for any of the insurance companies, then with everybody paying in, we can lower costs. Well, part of the public options being there is to be that watchdog to make sure that that happens. And so with moving forward with saying that the young woman who spoke, who found herself, from birth on having to fight with insurance companies or not having access to coverage, that's inexcusable. We can come together to make sure that people do have access to health insurance, and a public option can be part of the solution for Americans right now. We have a lot that we can talk about more through emails, letters, and phone calls. But I just want to go back to what I started out saying before. This is the future of healthcare if we do nothing. Family budgets will continue to be crippled. Employers, and I've been meeting with employers will start to drop coverage. We can have the status quo, have our insurance rates go up, with the same status quo of being 37 for where we rank in healthcare delivery, and have more employers start to not offer insurance because it is just not economically feasible. Or we can come together and work on this draft. This is a draft, and that's why I'm hearing from you today, to take your thoughts, your ideas, your suggestions, and your concerns back to Washington. We can move forward to try to find ways to lower costs, to keep the choice that I've heard is so dear to all of you, and is dear to my family as well. But we need to do it in a way that has stability and peace of mind, so that if your employment situation changes, you know you have coverage. If you have an experience in your family with a loved one who has a chronic disease, or has, as we were shared with here with the young woman, something that happens at birth, that family is not faced with making decisions, their finances at risk with bankruptcy. And we can work to be more supportive of our doctors and nurses and those who provide health care. Whether I heard the same thing from individuals who were pro-public option, pro-single payer, or pro for the status quo. And that is to let physicians and nurses and those who are delivering the health care be the ones to make decisions and to get the gatekeepers out of the way. We trust our doctors, we trust our nurses to be part of our advocacy and make the decision together ourselves. So I want to thank you for your comments. I want to thank you for your concerns that you shared. There was a diversity of opinion here today. And when I go back to Congress, there's also a large diversity of opinion.
Excuse me, so the really central part of the opinion tonight is single payer. And you have not responded to that issue.
Excuse me, no.
You've not responded to that issue. You've talked around it. You say wonderful things, but you need to respond.
I would like to finish my comments.
Please.
Thank you.
And respond to us, please. We haven't heard you respond.
I'm sorry, but if I can't be heard, I'm not going to speak.
Go ahead. You have plenty of time. Go ahead. What are you saying about single payer?
I would like to thank you all for coming, and I'm going to conclude at this point because we have lost having.
You have